In the swine industry today, there are multiple diseases that have a large impact on the industry as well as the economy. Today, we will discuss the major diseases affecting swine around the world. Some of the most common respiratory diseases include PRRS, atrophic rhinitis, mycoplasma pneumonia, actinobacillus, pleural pneumonia, and swine influenza. The most common respiratory disease affecting pigs globally today is PRRS. PRRS can occur in all age groups. The reproductive side of this disease is more obvious in sows and gilts, while the respiratory syndrome generally affects the young growing pigs, but also occurs in naive finishing pigs and breeding stock. PRRS imposes a substantial financial burden on U.S. swine producers and costs the U.S. approximately $1 billion. The best way to treat PRRS is to have good biosecurity on your farm as well as vaccinations for your hogs. Prior to PRRS, the second most common reproductive diseases are parvovirus and leptospirosis. In the reproductive disease category, parvovirus is the most commonly diagnosed infectious cause of reproductive failure in swine. Clinical signs for parvovirus are inapparent in all swine except the developing fetuses. However, after the first 30 days of gestation, there's embryonic mortality. Day 30 to 70, there's mummified pigs at farrowing, and day 70 to term, the fetuses may begin to fight off the infection. The best way to prevent the infection of parvovirus in your herd is to vaccinate all susceptible breeding stock twice, 2 weeks apart and several weeks before breeding. Killed vaccines are available for parvovirus and have been proven to be effective. However, there is no treatment for parvovirus infection. Circovirus is also known as post-weaning multisystemic wasting syndrome. The virus is stable in the environment, making it impossible to get rid of. Circovirus usually occurs in nursing or growing pigs and is diagnosed on a herd level through the occurrence of multiple features. The most common clinical signs include loss of body condition in infected animals, enlarged lymph nodes, diarrhea, jaundice, and sudden death. Since circovirus is such a widespread disease, diagnosis for it usually requires a blood test in which most pigs are positive without any clinical signs. Due to the severity of this disease, there is no treatment. For prevention, it is best to use good production practices such as the all-in, all-out pig flow, proper environmental control, and sanitation of facilities. There is also a vaccination for this virus, but it is extremely costly. Many herd health challenges exist for today's pork producers. Bacterial and viral diseases of pigs can cause varying levels of illnesses that can have a negative impact on the well-being of swine as well as consumers. One way to help fix these herd health challenges is to obtain a better understanding of these diseases.